I'm glad to be here this afternoon. I have just recently finished up my third year of teaching at UMKC in the music therapy department there, so starting to feel like Kansas City is home a little bit. And I primarily work with wellness settings right now. So I have an intergenerational rock ensemble that I do through the Landon Center, and then I have some wellness senior piano programs that I do at the Senior Center, Palestine Senior Center over 35th and Prospect. But I have a love of music with any aging population, and how do you make that connection to foster positive experiences with the patients or clients as well as their caregivers. So I think that any music presentation should always start with a little bit of music. So you have no task to do right now, just to sit and be present, and we're going to have a little bit of a musical journey. Of course, I'm going to ask you some questions afterwards, so be prepared. But right now, just sit and enjoy.
Love me tender.
I see more mouthing of the words going on. We're recognizing it a little bit more. You can sing if you want. So that was just a short demonstration, not live, but using music on what a music therapist might do on any given day, which is the idea of ISO principle, and using the music to kind of take you through reminiscing, moving you from one period of emotion to another. And so I'm going to ask you just a few questions. What did you notice when you were listening to it? Just for you personally. Anyone?
Made me happy.
Made you happy? Okay.
Songs brought back memories.
Memories.
Yeah.
Yeah, it was like time travel.
Right. And those are all positive things about using music, right? Everyone has some sort of reaction or memory to music. And those memories can be embedded in whether we're hearing something that all of a sudden we are remembering what we were doing at a time, what we ate at a time, the smells that were going on at a time. Music has that power and can be a powerful tool for the use of therapy. One of the other things, I don't know if you noticed, is that it started off really slow, right? Because nobody, well, I didn't know you all yet, right? So I wasn't going to come in guns a-blazing. But it starts off kind of slow, matching where we are, and then it slowly started picking up tempo. I could look underneath the table and see that people's feet were starting to move. I saw some clapping going over here, the mouthing of the words, one brave person, then another one got the rolling on the Proud Mary, right? So all of a sudden it's just taking you somewhere. So what I'm going to be talking to you first off is just kind of the basics of what music therapy is, what a music therapist does, and then how anyone can use music in caregiving experiences. So we'll be following along with this. So this is our basic definition from our organization, AMT, about music therapy. And basically that we use music to work on non-musical goals in the areas of physical, emotional, cognitive, and social needs. And especially as that focuses and depends on when we're working with older adults. And whether we're working from wellness through all the stages of Alzheimer's to Parkinson's to hospice, those things are going to look a little bit different. And one of the neat things about music therapy is that you'll often hear that a music therapist will use 5 interventions. We use more than 5 interventions, but just say we're doing songwriting. Well, we don't just use songwriting for isolation. We can use songwriting for isolation. We can use songwriting for emotional expression. It can be used for many multiple things. So one intervention or one music application won't just match one problem, which is a really good thing. And then when we're talking about, well, why music? Why does it even work? One, just because it's universal. Almost every culture has music in it, right? And music can be flexible. It could be very simple, like something like Happy Birthday or Twinkle, Twinkle, Little Star, where the melody line is not very complex and it may just have a couple chords into it, into something like really complex jazz, where you're having to listen to what all the instruments are doing and trying to maintain that form. And everyone has a continuum of where they enjoy musical experiences on that. It can facilitate structure, right? We use music for our own everyday lives. We may use music in our household chores. We may use music to cut down on driving. I know I like to use music when I'm exercising because I get bored very easily. We may use music also to structure events, right? We know that the bride is coming because we hear, here comes the bride, right? You know at a restaurant that they're celebrating a birthday because whatever that restaurant is, they have that annoying birthday song that they're going to come out and clap, right? So it can facilitate structure, as well as providing integration and connection to society, because regardless of someone's ability level, physically, cognitively, emotionally, everyone can experience music, whether it's active or just passively listening and having memories come back. And then it's the great equalizer, because when you look at an ensemble made up of people, you might not be able to tell who the people are in that ensemble, right? You would be able to tell basic things like race, gender, age, but you wouldn't be able to tell ability levels and functioning levels. Right, so as you look at these two pictures here, this is some work that I've done with some older adult choirs. You probably can't guess who has Alzheimer's disease. And you probably can't guess who are the members of the Parkinson's choir. And you probably can't guess who lives at the assisted living facility versus who lives in the community, right? Because as you look at that picture, they all appear to be holding hands together. They were probably singing and all partaking in this musical experience together, right? So that's why I get to have fun using music all the time. So just some ways that music therapists use music. One is a cue, so if we want to cue a behavior or a reaction to occur. We also use it to structure the environment. Using it as reinforcement, right? When you have someone who needs to maybe be working on a physical movement, doing this over and over and over might be tedious and boring, but if I put a drum on the end of it, now you're getting some sort of auditory cue and it's a little reinforcing. And if I have my guitar going at the same time playing your favorite song, it's going to be even more rewarding to sing this for an entire verse of You Ain't Nothing But a Hound Dog, or one of the other songs we were listening to earlier. Or as a vehicle for self-expression, right? So being able to identify what's going on in lyrics and being able to express and rewrite your own songs and share memories. Some common goals that music therapists might be using: to promote wellness, to manage stress, which is a big thing for all clients, alleviating pain, right? Because we can use music as a distractor from the pain when it's going on. For expressing feelings, which we've talked about before. Enhancing memory, just in that short clip, you all had experiences and memories that probably came back related to the different songs that we were listening to. To improve communication. To promote physical rehabilitation. I want you to take out a pen and something to write with. You should be able to see this slide, and I'm going to have you just write a couple responses. So just want you to take a few minutes to answer your mood music. So when I am sad, I listen to, and you can put in whatever type of music that is. When I am cleaning, I listen to. When I am relaxing, I listen to. And when I am happy, I listen to. So 4 different categories of music experiences and listening. So do I have a volunteer who might be willing to share their when they are sad, they listen to? Yes.
I combined it with both sad and if I'm feeling worried or anxious. And
Okay.
For me, that's usually kind of more, I guess, spiritually uplifting music. So I go to Christian rock.
Okay, so Christian rock and spiritually uplifting when you're feeling sad or anxious. And why that type of music? Why do you go for that?
More, you know, if you pay attention, as I try to do, and listen to the lyrics, they kind of take the focus off of myself and my issues or problems and just kind of put the focus on my faith.
Okay, so that sounds good. So going for the lyrics and using that as a frame of reference for faith and kind of trying to help the situation. Okay, thank you for sharing. Somebody else sad? Yes?
I actually listen to Christmas music.
Christmas music. Why Christmas music?
I love Christmas. So it just brings back, you know, memories and fun and like, I remember my freshman year in college, I hated college, so I would sit there and listen to Christmas music constantly throughout the whole entire year. My roommate thought I was crazy, but it would make me happy and, you know, think of things that were happy, so.
Yeah. Okay, so Christmas music, the music that makes you happy and you have a lot of emotions attached to that probably. Anyone else, when you're sad, like to listen to something different?
I'm doing an opposite response here. Like
That's
when I'm
okay.
sad, I want to go all the way to the bottom.
And then slowly bring yourself up.
Joni Mitchell, Blue Album.
most specifically, I'm going to the bottom with Joni Mitchell, right, sinking right down there. And how about the woman next to you?
I'm similar. I mean, I listened to like the blues, and when I was in college, I remember listening to Dan Fogelberg and Linda Ronstadt, and I mean, wherever it kind of, somehow listening to somebody else be down doesn't bother me quite as much as me being down. I don't know.
Okay, so listening to music that is down to kind of match. So we kind of have two opposites. We have some people who are falling into the camp of, I want to feel uplifted, so I'm going to listen to something that makes me feel uplifted, right? And then we have others who are like, nope, I'm going to match it. I feel down, I'm going to stay down until I'm ready to listen to someone else that's going to bring me out of it. How about when I'm cleaning? What do people like to listen to?
I'm all about Tool when I'm cleaning.
All about Tool.
Metal.
So you need a little bit of metal to keep it going, right? Does anyone like to listen to anything slow and relaxing when they're cleaning? No, I've got no's all around. You need the upbeat to keep it going. Okay, what about relaxing? Yes?
I actually like to play. I'm a musician. I do it full time. So for me, relaxing is playing something I like to do or working out some ideas.
Okay. And do you have a specific genre or type of music that you like to play when you're relaxing?
I started playing piano when I was 7, cello when I was 9, so it can be anything from rock to Bach.
Okay. Rock to Bach, a very wide genre, right? Which is most of the time what happens when you ask a musician, like, what's their favorite song? You know, really? There's like 20, 50.
Your favorite child.
Exactly, exactly. Anyone else for relaxing?
I just found a new band that I highly recommend.
Okay.
M83.
M83.
Mellow and just, I have really talk about lyrics that like move you. They're really good.
Nice. And then the last category, I have to check that out. When I am happy. What do people like to listen to when they're happy? Nobody listens to music when they're happy, right?
I'll jump in here. Well, of course, rock and roll, but Zydeco's great when you're happy.
Okay. Well, I have another question that's not on the list. Does your music choice tend to be geared towards the music, like the instrumentation and the chords and what's going on, or are you more attached to lyrics? So I'll take a show of hand. Those who are attached to the music, that's what drives you for listening to a song? A good number of people. And those who are attached to the lyrics, that's what drives you. All right, and then both. Exactly, and probably depends on the hour, the second, what just happened, 15 minutes.
The beat itself attracts you, and then like after you hear it a few times, you actually start listening to what they're saying. Like,
it's different for everyone, so that makes sense. I am horrible with words, which is hilarious that I'm a music therapist, but I'm attached more to the music first, and then it's like, oh, I didn't know that was a sad song, you know, after 20 times of listening through it, right? But what I've just demonstrated here and what you all have demonstrated is just the difference, right? Everyone is different in what drives them to music. And anytime you want to use music in a caregiving experience, it's important to find out what that person's preference is and what drives them and what they are geared towards. That's how it's going to assist them the best, right? One of the things we like to do when we're using music is to match the person where they are. So my ladies over here who said they like to get down, a lot of times we will play something that's a little bit more relaxing or somber and then slowly move the person, right? So you don't have to all the time, if you're feeling a certain way, you don't have to do the opposite of it. You can try to match it for a little bit and then change it. So that's another little hint. When you're thinking about using music with any age, you want to think of some different factors. And one is the age, right? So we tend to think that what people most enjoy are music from their young adult years. So whatever was popular during the 20s, that's kind of like the best band still in everyone's mind, right? So making sure that you're bringing in that type of preferred music. Their cultural background, right? So for me, my parents are from Belize. So if I were going to provide music for my parents, I would probably have to do some sort of Caribbean thing, right? But looking at them, if they were sitting next to another African American in a facility, you would just assume that they were black and they want to hear the same thing, right? But that would be a little bit different, especially if you tried to then compare it to an African American person who is from the South, right? Maybe they're listening to something different. It could be country. If they were overly religious, it could be Southern Baptist, which is completely different from Presbyterian, which is different from, and on and on and on and on, right? So knowing what someone's cultural background will influence what type of music that they like to listen to. And then their family influences, right? So what music did you grow up listening to that your parents, right? You're influenced by so many different things. And then previous involvement with music. If someone played an instrument before, and depending on how those lessons and experiences went, is going to affect how they respond to music, right? If they had an instructor who always used to hit them on the hand when they played their violin, they might not want to hear classical music, right? Or it might be the completely different because of those memories that are associated with. Memories associated with specific songs. This is particularly important when people are dealing with loss, right? Because a song can trigger something like a moment. I used to work in hospice, and we used to do grief support for family members who had lost someone. And we would do this group maybe about 6 weeks, 8 weeks or so after the loss of their loved one. And we'd do music therapists and social work together. And we would do all these music experiences and getting them to identify what type of music they liked to listen to. And I always remember this one woman who said she loved music up until the time that she lost her husband. And she can't even turn on the radio in the car because it was too painful for her, because that was an experience that they used to share together. They had so much love for music together. So just knowing that while it can provide strong positive emotions, it could also maybe bring some negative emotions as well. And then preference is the biggest thing, right? We're all going to respond to what we prefer. We're all going to have feeling more comfortable if we're hearing the music that we prefer that makes us comfortable. Familiar versus unfamiliar. Again, when we're listening to songs that we know, or by a band that's similar to what we know, we're trying to put it into that context. Versus if we're listening to something that's completely unfamiliar, you might have to listen to it 5-6 times before we even hear what the lyrics are. Or if we can get past the fact that this just sounds like noise, I don't really like it, right? And then the current mood kind of trumps everything, right? The way the person is feeling right in that moment is going to affect how they process the music. The tempo, right? When we're feeling happy and upbeat, we might not want to be listening to something that is slow and in a slow groove, right? When we want to relax, we probably don't want to listen to something very, very upbeat. So thinking about those things as well. And then the volume, making sure that it's at a volume that's not too loud and overbearing. And then lyrics versus the content, right? So you can pick a song that's based on the lyrics that are in there, and that can really help drive. So some ways to use music, even without being a music therapist, some of the things that we've been talking about today. So using music to address memories, right? Because so many memories are associated with music. Using music to address emotions. What type of music do you like to listen to when you're happy? Using music to promote relaxation, right? If you're just having someone just sit and listen for a little bit, that can really help with some relaxation. And then just a couple music techniques, right? So reminiscing through music. Just listening to a song that has some sort of relevance or memory, and then asking someone about their experiences of why do you like that song? What do you recall about that song? What memories does it bring out? Then you have a tool to begin speaking with them. Singing with music, right? You can do that along with any recorded music. Something that is familiar to someone, singing along would be great. And music listening, like we kind of did in the beginning, whether it's active or passive, that can be an enjoyable thing. And then I just kind of wanted to finish up just talking through these are for you to take home to your bag of tricks. You may have some use for it now, you may have use for it later. Just some different applications in ways that you can use music as a non-music therapist, right? So making sure the idea is to reminisce through music, making sure that you're choosing music that is from a variety of genres and times and periods, and kind of having those different recordings. And if I can just see a quick show of hands, because I know we all went around the room in the beginning, how many people work directly with people or have some sort of connection with someone that has Alzheimer's or in hospice? Okay, so a lot, which is good. For those of you who have those experiences, have you ever used music before in your situation? Okay, and how do you use it? Or how have you used it in the past? Yes?
Mine was with a person who was autistic and who was also going into dementia.
Okay.
Who had loved opera.
Mm-hmm.
So I took him to everything that had to do with opera music or classical music, and what it did was that it prevented him from being self-abusive. It was amazing. As long as we were consistent, and then he had that music to play in his room at all times.
And what made you think of doing those things? Had you ever heard anything, or it was just kind of intuition?
It was intuition with him. I worked with him for 23 years, and so you just kind of picked up on what kept him mellow and what threw him over the edge. Yeah. But I have another lady who has Alzheimer's, and she will not listen to music.
And you hit on a perfect point. Every person is so different. And what you described with your first experience was perfect. That idea of if you're going to use music with someone who has Alzheimer's, and maybe you're going to try and use it when they have disruptive behaviors, the key is to finding out what triggers the disruptive behaviors and then getting that music experience in before so that they can be a little bit more relaxed and not have that. I always giggle to myself. When I first started working in hospice, I had received some referrals from a music therapist who was already seeing the clients, and I had several in nursing homes that went well. And then I had this one gentleman who I thought, why is he on music therapy and why am I here? Because I had my guitar and my bag of tricks, and every time I would go into the room he would scream. I was like, wait, this isn't good. This is definitely, I don't want anybody coming to see this. And what I came through this process of experience and discovery was that my guitar and my voice was too overstimulating for him. Sensory-wise, it was too much. And what I had to do was a complete adaptation in which I brought in an instrument called the dulcimer. I don't know if anyone, I love the dulcimer. And what I love about it is that it has a drone tone kind of going through it, but I like it because you can provide chords or you can play the melody. So I no longer had to sing for him in moments, and so I was able to bring this dulcimer in, place it bedside with him, and play songs that were preferred. And I had this gentleman who was turned up this way, completely away from me for the majority of the session, and then when I had the dulcimer, watching that, him coming and turning around and looking at the dulcimer and having a conversation, and no more yelling, and most importantly saying goodbye to me as I left the room, right? So noticing that what works for one won't work for another, but don't be scared not to use music, but just being aware that, like on that factors list that we talked about, there can be many, many, many things that are affecting why people respond to music. Does anyone else want to share their experience with using music? Here, and then we'll come over here.
We use it for ambulation. When they start to hesitate, we can get them to start stepping into the music.
Perfect. That's a great way to use it.
I came from a facility up north right after I went to nursing school that had a hospice program that when a person was dying, we had a set protocol, and we would bring in, it was our death cart basically, but it had a CD player on it, and it had Christian music that they didn't know as well, because the person who had set up the program, the research they had done showed that if it's music they know better, they kind of get into it and they kind of hang on longer. But if it's Christian music that was soothing, but that they didn't know, so they didn't really get into the music, then it helped them through that actual dying process. It was really, we utilized that. I mean, we had a set protocol, and we brought in that cart, and of course if family told us not to, we didn't. But it did seem to keep people calmer.
Yeah. And that's kind of that one factor of familiar versus unfamiliar, right? Familiar is great, but sometimes you might want something that's unfamiliar that someone's not attached to as much based on what the activity or the plan is of how you want to use the music. So that makes a lot of sense. Anyone else? Yes.
We had a resident in one of our homes who was a retired minister who had a wonderful voice, and while at that point in time he'd lost the ability to talk and communicate, and his daughter gave us a videotape of him singing hymns around the house and also in his at his church. And you pop that video in, and he would just start singing. He was watching himself on the video, and he would just chime right in and knew all the words. It was crystal clear, whereas was very hard to understand him if you were trying to have a conversation with him. So it was really powerful.
And that ability to sing when you can't talk, or that ability to be present and in your environment when music is there, is a really, really important thing. I have just a few more, I'm going to skip past these, just additional ways to use music. And this one's kind of my favorite. The music with nonverbal communication. It's on your last slide. One thing that's great, and it's so simple, and we all have it within us, is music and touch, pairing those two things together, right? And when we think of any of our aging clientele that we may work with, one of the things that they sometimes suffer from is skin hunger because of your lack of touch, right? And if you think of the aging population as we age, there's so many barriers to receiving touch, whether it is your skin is starting to change, whether it is you're in a hospital bed, whether you're in a wheelchair, whether it's just difficult to get around and touch the person, right? And if you think about you throughout your lives, we all receive touch and give touch, and that's such an important thing. So research has shown that even just singing a cappella, no instrument, no CD, and providing a touch to someone can be very comforting and a way to connect them back to the environment. So an easy application that you can do. And again, that music listening, and then sort of like you were talking about with the videotape of the person, just singing that music that is meaningful to the individual is always going to assist with them feeling a little bit better. And then the last one, anytime you can have someone move, whether it's dancing or whether it's really specifically programming for ambulation and different things, can be really great ways. Any questions?
I was going to add, I had a laugh when you put the social dancing in. My dad loved music his entire life, but my mother was a great dancer and she could never get him to dance. But in his last year, when they did music therapy, I would walk in regularly at visits and he would be up dancing with every woman in the room. He would just, you know, they could not keep him in his chair and they would be around. So it's amazing how the love of music coupled with the lack of inhibition.
It just goes together well. Love of music and lack of inhibition puts together for a wonderful time. Right? Good times had by all. Yes?
How long are your music sessions usually when you're working with a dementia patient or a hospice patient?
You know, it depends. It depends is the best way to say it. It depends on the frequency. I'm sorry, your question was how long are the music sessions when I'm working with someone who has dementia or hospice for the video. And it depends. It depends on the stage that the person is on and what their care plan says about how oftentimes they should be receiving music therapy services. So a lot of my, when I was working with late stage dementia, I would do maybe 2 to 3 times a week, and I would do a 30-minute session, and that was about what they could tolerate. But if I came in and the music isn't working, like if the person's just not getting less agitated, then I may cut the session short and come back. But when I worked in hospice setting, I had the flexibility that I could come back the next day or come back, because my caseload was more of a see a couple times a week, which is a little bit different in private practice. If you just have a contract that you're coming over once a week, you might not have that flexibility to fit them back in. So it really depends on the music therapist as well as the client's needs. But what I did find when I was doing the hospice, and especially with my late stage Alzheimer's patients, I found that if I would have to wait for them to be present with me. So about 15 minutes of introduction and music before I could get to the point where I could get them to really be alert as they were declining. So that 30-minute session is good for, we just need 15 minutes of trying to get the person to realize that I'm there. When I was doing a research project with touch and instruments, I had a day where one of the patients that I saw, she was in a wheelchair, and her chair was probably here, and I had a video camera like here, and I was sitting here in a chair with my guitar, and she was moving that wheelchair back and forth, and I had to keep moving my foot out of the way because she had no idea I was there. I mean, I was there, but she wasn't there with me. That wasn't productive. I mean, I was just singing to her, versus when I brought in my instruments and I was touching her, no longer did I have to worry about my foot. You know, it would be intact. She was no longer trying to run over my foot. She was with me, eye connection, eye contact, verbalizing or vocalizing to some of the songs. So, in a roundabout way, answer. Any other questions? Yes?
Just curious, what is your favorite type of music? What do you like?
It depends on the day. So my favorite type of music really depends on the day. But funny enough, this is totally not related to my job at all. A couple weeks ago, there was a documentary, Marley, that was at the Tivoli. So I went to see it and I reclaimed my love for Bob Marley music. So I've been listening to that like nonstop on repeat. And that has been influencing me. And then randomly enough, sometimes what I'm doing in my work will influence me. So I remember that I'm not much of a country music lover, or I used to not be, but I had a client whose preferred music was country. So for like weeks, that's all that I was listening to so that I could do it stylistically appropriate and things like that. And then I do an intergenerational rock ensemble. So when we are in concert mode, I'm listening to We Will Rock You on repeat forever and really getting into my Queen. So it really just depends on the day and the mood, and it just, sometimes I'm in the mood for classical, sometimes I'm in the mood for hymns. It's all over the place. Yeah.
What
Yes.
might be a good source to look into if I thought maybe I could incorporate some music therapy into our recreational program here?
Not to selfishly self-promote, but but I will for just a second. I wrote a textbook with 3 other music therapy faculty and it's called Music Therapy for Healthcare Professionals. And what's really neat about it, it's the clinical applications a few slides ago. It's a book full of those. And what's nice about it is it's for everyone. So there is for basic volunteer who has no idea about music, all I can do is put on a CD player. There's for people who have some music experience but aren't music therapists, and then there are some applications for music therapists. And it's based on research and practice. And so there's a section on hospice, a section on Alzheimer's, a section on wellness, and a section on intergenerational. And then another resource that I would encourage you all to use is the music therapist in the room, Rochelle. She has a wonderful blog on music therapy experiences in her work with older adults in the Kansas City area, and she's a great resource. Yeah. And then the last would probably be our music therapy website, AMTA. The website is musictherapy.org. And so you can find all sorts of fact sheets on there. You can find if you're looking for a music therapist in your area ever, and just some nice ideas and things.
Thank you.
Yeah, that's a great way. And just the idea to remember that, while music therapists do trained music interventions and applications, we all have an innate reaction to music. So there are ways that you can use music to enhance what you're doing in your programs and experiences.
Thank you very much.
Well, thank you for having me this afternoon.